my name is Adriana and I'm going to be the nurse taking care of you today. Today we are going to be doing an NG tube insertion and removal. So the first thing I'm going to do is just gather my supplies, shut the door for privacy, and I'm going to wash my hands. Can you please tell me your name and date of birth?
Anthony Saunders, 4493.
Okay. I'm going to make sure the patient is in a comfortable working height and also make sure that he is in high Fowler's position. I'm going to assess the patient's nasal passage first with a pen light. And I'm also going to assess his gag reflex with a tongue blade. Next thing I'm going to do is explain how to communicate. So during this procedure it will be kind of difficult to communicate, so just raise your hand if you need anything. So I'm going to open the NG tube and I'm going to measure from the patient's nose to back of the ear down to the xiphoid process. And then I'm just going to mark that spot with a piece of tape so I do not have to remember the number. And then also at this time I'm just gonna prepare the piece of tape for when I insert the tube. Okay, I'm going to cover the patient's chest with a towel. And then I'm also going to hand the patient a emesis basin and a cup of water with a straw. And then I'm using lubricant jelly. I'm just going to put the tip of the tube. First I'm going to put on clean gloves. And then with the lubricant jelly, I'm going to just put some lubricant on the end of the tube. And then I'm going to instruct the patient to put his chin to his chest and slowly sip water and slowly insert this into the nares. And with each swallow, I will insert more. If there's any type of resistance, I would pull back and wait for that to be resolved. So I'm just gonna go until I hit the part where I marked the tape. Okay. And then I'm going to, you can look up, and then I'm going to just secure the tube to his nose. And then just for the purpose of the video, I'm just going to put another piece of tape so it doesn't move. Okay, and then I'm going to take my pen light and just look in the back of the throat. Okay, I'll take this from you. And then with a stethoscope, I'm also going to auscultate for breath sounds. Okay. And then I am going to, with a syringe, aspirate some gastric contents. And I will do not with the blue tube, but with the clear one. Just aspirate a small amount. And then I'm going to, in a small cup, put those gastric contents into that and measure the pH. I'm also going to assess what that gastric contents looks like as well. And I'm also going with a pen, just going to mark where it is on the nose in case it were to move or anything. And then I'm also going to remove this, and I would fasten the tube to the gown as well. And then I would dispose of my dirty gloves, perform hand hygiene, and don clean gloves. I'm also going to make sure the patient, when I'm doing the removal, is sitting upright as he is now. Make sure that I have suction available. And then with a clean towel, I'm going to place that over the patient's chest again. And then I'm also going to make sure that the patient has tissues nearby in case he needs them. I'm going to remove the tape from the patient's nose. And then I'm going to instruct the patient to hold his breath, and I'm going to gently and steadily withdraw the tube, controlling the tip. I'm going to inspect the tube for any signs of infection and to make sure that the integrity of the tube is adequate. And I'm going to put that aside. Take this off. Throw away my supplies. And then I'm just going to also make sure that the patient is comfortable in bed and has the call light nearby. And then I will document the insertion and removal of the NG tube.